Welcome to another episode of the Chief Healthcare Officer, where we decode the secrets of success in healthcare management, dissect the latest trends, and build a community of forward-thinking healthcare leaders. I'm your host, Dr. Fatih Mehmet Gül, and today we have a very special guest joining us, Dr. Simon Fleming. Dr. Simon is not only an orthopedic surgeon, but also a renowned advocate of cultural change within the healthcare sector. He has gained international recognition for his Hammer It Out campaign, which addresses bullying, discrimination, and harassment in healthcare settings. His efforts have earned him numerous awards and made him a sought-after speaker on leadership and workplace culture. In this episode, we will delve into the challenges of creating a just culture in healthcare, the pivotal role of leadership in driving change, and the importance of respectful work environments. Dr. Simon will share his insights on combating toxic behaviors, the impact of effective medical education, and his vision for the future of healthcare workplaces. Stay tuned as we explore these critical topics with Dr. Simon. Let's dive in. Dr. Simon, thanks for joining us today.
No, thank you for having me.
No, it's our pleasure. We have started this podcast show as a healthcare leadership, healthcare management, healthcare culture podcast. There are some topics which are easy to discuss, some topics that are not that easy. So this is one other, bitter taste subject that we have in our healthcare domain. We will start discussing, but just before we start, can you just give us more about your background? You're a surgeon, then you ended up as an advocate for such an important subject. We want to know more about you, then we will start the discussions.
Thank you very much. I'll do my best to make it sound interesting and not like a boring medical dating profile or something. I'm an orthopedic surgeon. I'm a consultant orthopedic hand and wrist surgeon. My journey kind of started when I was a medical student, and I had what I guess we recognize now as moral injury. That is to say, when you are either forced to or encouraged to act against your core values. So many of us have that around COVID, for example, when we couldn't get people into ICU or couldn't wear the right PPE. And fundamentally, the emotions associated with moral injury are shame and guilt and anger, I guess. And, as a med student, there would be behaviors that I was undeniably complicit in, the unacceptable behaviors, the unacceptable jokes and all that sort of stuff. And it wouldn't sit comfortably with me. But of course, like all human beings, I wanted to belong and I wanted to fit in. And so, yes, I would joke along and laugh along and high five with the others. And sometimes I would even be the one instigating these behaviors. But in my quiet moments when I was alone, or when I was speaking to close friends, I would always say, look, I just, I feel dirty. But I wasn't sure whether it was just me. And it kind of felt like maybe it was just me because no one else seemed to have a problem. No one else seemed to complain about the behaviors and attitudes that existed. And then I became a doctor and those behaviors persisted as you would imagine they would, right? Nothing changes. And of course you start to think about, well, where do I want to go and who do I want to be and what kind of specialist do I want to be? And I realized very quickly I was more of a surgeon than a physician. One of my old consultants used to say that it suited my ego and my attention span. I liked fixing things, whether it was patients or problems or whatever. But again, there would be these moments of moral injury, of just feeling like I didn't fit in and like maybe it wasn't the right place for me. And maybe this community that I really identified as being where I wanted to be for the rest of my life just wasn't for me. And that kind of persisted until eventually I became a training orthopedic surgeon and orthopedic registrar. And I became part of the British Orthopaedic Trainee Association, which is an organization that represents all United Kingdom orthopedic trainees, from aspiring surgeons all the way up to, you're at the end of your training. And again, I would have these moments of, is this all of us? Is it just me? What's wrong? Why are these behaviors sitting so uncomfortably with me? And I got on the committee and I became the education rep and then the vice president. And we would sit in these big meetings with these big, powerful organizations. And, they would say, Simon, how dare you speak on behalf of women, people of color, members of the LGBTQ community, people from financially less privileged backgrounds, whatever. And I did that thing that surgeons are just so very, very famous for. I reflected, as we all did, about whether we were missing something, whether we really were representative of our membership, or whether in fact we were speaking for people rather than amplifying their voices, speaking on behalf of people, which is really not advocacy at all, right? It's very kind of white knight patriarchal to just speak on behalf of someone. And so we as a committee, when I was vice president, decided to do something that had never been done before, which was a census. We wanted to ask our entire membership, all of the orthopedic surgeons in the UK, or training orthopedic surgeons, should I say. We wanted to ask them about what life was like for them, what training was like for them. And when we were designing the census, I kind of put my hand up and I said, can we ask some questions about culture? And everyone knew that I wanted to be president, and there's no succession planning, it's an election process. And they said, look, is this the hill you want to die on? And I was like, look, I think there's something wrong with orthopedic culture. And I don't know if it's just me, but I feel like it's not. I feel like maybe I'm just the only one willing to say it. And so they all kind of said, look, you know what, man, you go for it. You do you. So in this census, we asked about training and appraisal and how far do you have to commute to get to your teaching sessions and all the usual kind of stuff that trainees complain about and want to be improved and all the rest. And I was able to convince the committee to put some questions in about bullying, undermining, harassment, and discrimination, which are pretty emotive terms. And, definitions were important. So for me, and for when we spoke about it at the time of gathering the data, bullying is about power and about silence. Bullying is about, I'm going to make you come in and do a project on your time off because you need my signature. I'm going to make jokes about your appearance and you're going to laugh because you're afraid of me. I'm going to tell you that you have to tolerate my sexist behavior because otherwise I'll ruin your career, etc. But there's some overlap. So undermining is more subtle and nuanced. It's more insidious. Undermining is where you make someone feel small and worthless. Undermining is where I say, oh my God, what medical school did you go to? Did they even have books in your library? Goodness me. It's not quite bullying, but it's definitely not kind or respectful in any way. Though I'd kind of hate that word kind, and we can come to that if you want. And then discrimination and harassment are the ones that certainly in the United Kingdom are protected in law. So discrimination is where you are treated differently because of certain characteristics. Basically, you are treated differently because of who you are, whether you're a woman, a person of color, a pregnant person, etc. And harassment is where you are offended or attacked in some way because of those same characteristics. And I wanted to ask people whether they'd experienced those behaviors or whether they'd witnessed them. And the data we got, which at the time, and I say this unashamedly, the data we got, which was the first of its kind in the UK really, and the first of its kind pretty much globally, was groundbreaking and horrifying, and for me at least, not a surprise at all. The data showed that 70 or more % of orthopedic trainees had either witnessed or experienced these behaviors. And that was where my journey started. I thought it was going to be a little passion project, and I was going to find that there were, 6 other people in the United Kingdom who thought maybe things weren't quite right. And instead, it turned out that we had a problem in orthopedic culture. And and
on this day, you came to know that you're not alone. It was just not you.
Absolutely, which is a huge part of culture change and advocacy, because of course one of the greatest weapons of those who try to maintain the status quo is to make you feel isolated and to make you feel like you're the only one who sees a problem or who perceives a problem or who can do something about it. And suddenly it wasn't just me. I wasn't the only one feeling these feelings. And so began the Hammer It Out campaign, and that was in 2015 going into 16. But again, I just thought it was going to be an orthopedic problem. And very rapidly what happened was people started reaching out to me from initially other surgical specialties and then other critical care specialties, anesthetics, ICU, accident and emergency. And then eventually other specialties, the medics, the pediatricians. And then they started reaching out to me from around the world. And it became really apparent that it wasn't just me. It wasn't just orthopedics. And actually there was something really rotten at the core, at the foundations of healthcare, which isn't surprising if you think about it. Healthcare was built. One of the most common things you hear a lot of, at least certainly in kind of Western medicine, is this oversimplified idea that we need to fix medicine. We can fix it. Come here, Simon, come to our hospital and fix us. But medicine isn't broken. Medicine was built this way. Medicine was basically built, designed, conceptualized, and delivered by powerful men. And so all of healthcare has this foundation of patriarchy, of hierarchy, of power differentials and dynamics that form the foundation of everything we do. And that's why, if you think about the last couple of years trying to give patients more autonomy, there was resistance to that. Like, there were people who were like, no, I know best. Patients don't know what they're talking about. Why should we give them a choice? We should tell them what operation they should have or what medicine they need, And it became really apparent that the problems in healthcare culture were fundamentally the same. But what's been really interesting over my journey as a advocate, as an ally, as a what was I called recently? A creative disruptor, which is a very polite term for troublemaker. Because calling me a troublemaker means that I'm going to go, all right, you want me to cause trouble? I'll cause trouble. But it's interesting because every country, every culture, every specialty within those countries and cultures has its own context. So there's no simple roadmap that fixes everything.
We will come to the roadmap. So I'm happy to hear that. I mean, what has inspired you, and I mean, you have a point, and I don't think we can simply limit it to your surgical specialty. I mean, it is an issue in the healthcare industry today, and as you have summarized very well, there is an elephant in the room, and we all have to see this elephant, and we need to start talking about it. Now, the issue, we kept discussing things about shortage. We kept discussing things about inclusive workplace. And at the end of the day, we all know that healthcare is a people business. I mean, we hire people, we run this business, this operation with people. It's not just about the equipment and the other. I mean, today you have an MRI, tomorrow someone will have a better MRI, and then we'll continue. But if you don't have the work environment, and if you don't have the right emotional environment over there, which we call it just culture, people will keep silent. And I mean, I also had several meetings with our, especially the operation theater nurses, and I want to encourage them. I want to empower them. If in case anything they see wrong for the people's approach to them, or any kind of habits from the surgeons or from others, we want them to speak up. And God forbid if these teams, they don't speak. At the end of the day, patients will pay the bill, and we don't want this to happen. So you said that there is no one size actually fitting to all. Now, let's discuss about, the roadmap, as you say. We need some practical aspects of creating a just culture within the healthcare. So, what kind of effective strategies do you think we should bring to the table and then implement the cultural changes over there? Then we can just take it to the next levels, because no one wants to work in a toxic environment. These are all well-educated teams, very intelligent people, and we want them to work, and we want them to give their best to the patients and for the best strategy of the organization. So what do you think? What kind of practical aspects do you recommend?
Not before we come to that, but I guess the challenge you have is you've fallen into the classic trap, which is you assume everyone agrees with you. So the first practical step I would say is you have to convince both your leadership at every level, your capital L and small l leadership. And you also need to convince people at a grassroots level that what we're talking about, what we're discussing is actually worth doing, that it's actually a good idea, that it is worth changing and worth attempting to in some way modify. And actually that can be quite hard. And so one of the things I tend to do is I try and work out what people's why is. So for example, maybe your hospital's big focus, your capital L, small l leadership, and your stakeholders, your nurses and doctors and allied healthcare professionals, maybe they care about patient outcomes. Maybe that's their big driver. Well, look, if someone experience a negative workplace behavior, bullying, undermining, harassment, discrimination, say I experience it, 80% of people who experience that behavior will lose time during the day obsessing about that. Oh my goodness, why did he say that about me? What does he think? Did anyone else hear? Are people laughing behind my back? If I experience that behavior, there'll be a 40% reduction in the quality of my work, a 50% reduction in the time I spend at work. I will find sick days. I will leave work as early as I can. And 25% of people who experience a negative workplace behavior will take it out on patients. But here's the thing. Say you witness the behavior. Say, you watch me get called an idiot by a professor. If, as a witness, you witnessing a negative behavior will see a 20% decrease in your performance, a 50% decrease in your willingness to help others, and a 75% decrease in your general enthusiasm for the organization in which you work. In other words, these workplace behaviors, and there are other bigger papers in JAMA and the New England Journal, but fundamentally, these workplace behaviors both harm and kill your patients, and they harm and kill your staff because they're directly linked to burnout, depression, and suicidal ideation. But say you don't care about that. Say you are a sociopath and you have no interest in patients or your staff at all. There was a big paper done in the UK looking at bullying that showed it costs the NHS about £2.3 billion a year in errors, sick days, mistakes, complaints, law cases, all of that stuff. So even if you just care about money, the first step is to convince people that there is a reason to change, right? And the reason I'm describing that is it fits very much into the Kotter change model, which I don't know if you've discussed before, but the Kotter change model basically says that step one is you have to establish a feeling of urgency. You have to be like, look, we've got to do something now. And that's step one, right? Step one is convincing people that there's actually a problem. And often that's your biggest battle because so many people will tell you, oh, it never, again, a lot of your senior leadership will be men of a certain age, of a certain bank balance. And they'll say, well, I've never seen it. Doesn't happen to me. No one's ever complained to me. And so it's very hard to convince those people that, well, eminent Professor Simon, no one's ever sexually harassed you at work or mistaken you for the cleaning lady or made a racist joke to you or whatever, because you are, certainly in my context, an old white guy. That's your first battle, is creating a sense of urgency. Then you need to, and again, this is kind of Kotter change model, you need to come up with a coalition. You need to build a team. You need to bring people together. And again, previous attempts at changing workplace culture have failed because it's been big, important people doing performative and rhetorical work. They are doing it because they want a pat on the back and they want to be seen to be doing something so that people stop complaining. And actually what you need to do is take a deep breath and make sure that everyone who should be in the room is in the room, because then you come up with a strategy. And your strategy for pediatrics in Florida is going to be completely different to your strategy for pediatrics in Toronto, let alone a different specialty in Toronto. So your strategy that you come up with has to be, these are our problems, this is how we're going to deal with it. And within that strategy, that's when you can think about things like, for example, one of my favorite things for implementing workplace culture change is based on the Vanderbilt cup of coffee model. So Vanderbilt University in the United States looked at tens of thousands of what they call unprofessional incidents, and you can unpack what that means if you're interested. And what they said is that most people at work are fine; they have no issues, and if they behave in an unacceptable way at work, they are reflective enough to sort of just go, "Oh, I was a bit of an idiot today. I won't do that again," or they'll apologize or whatever. But say there is an incident. Say, again, I will use myself for the purposes here. Say I make a comment that is unacceptable. So the Vanderbilt model says that the first step should be what they call an informal cup of coffee conversation. That is to say, someone at a similar power level to me takes me to one side. So not in the corridor, not in the office, not in the operating theatre. They go, "Simon, can we have a chat?" And we go to, the local coffee shop, or we go to the library, somewhere where we can sit down and have a conversation. And basically, it's an informal, reflective conversation. Simon, can I let you know how that made people feel, how that made me feel, how that made the medical students in the room feel, whatever. And their paper shows that over 95% of people will change their behavior forever on the basis of that one conversation. Now, they won't like the conversation. They'll get defensive, they'll get angry, they'll roll their eyes, they'll whatever. But they'll take it on board. Now, the Vanderbilt model goes on to say, what if there's an apparent pattern? In other words, I keep doing it, right? It happens again. Then they call, the next step is called an awareness intervention. So that's where either that same person, same level of power as me, but normally with an ally or two, again, with same power as me, have a formal meeting. Look, Simon, I know that David sat you down over coffee last week and told you about how your jokes make people feel. Now you need to understand that this is a more serious conversation where, this is on the record. There's an email trail here or an audit trail or whatever. We need you to understand that this isn't how we do things here. But if you need support, if you need help, if you need some whatever, that's fine. But you need to understand that isn't how we do things here. The next step in their model is what they call the pattern persists. In other words, I still keep doing it. So then they talk about a guided intervention by authority. In other words, someone with much more power than me sits me down and goes, listen, Simon, stop it or else, or else you're fired, or else you're suspended, or else. And then the tip of their pyramid is a disciplinary intervention, suspension, calling the police, calling your regulatory body, whatever. Now, within their model, they recognize that certain behaviors have to skip a couple of steps. So, for example, if you sexually assault someone at work, you are not getting bought a cup of coffee, right? It jumps immediately to either a guided intervention by authority or a disciplinary intervention. Similarly, if I, what was I asked to help with recently? If I headbutt someone at work, I'm not getting bought a cup of coffee, right? It jumps a couple of steps. But it is a great and evidence-based system that you can introduce and train people in to challenge these negative behaviors. Now, that training has to also include things like assertiveness training, how to be an active bystander, because more often than not, this is stuff we witness and see and walk past, right? And there's this great quote of what you permit, you promote. In other words, what you walk past is what you say is normal. So you need to train your people up to be active bystanders, which means you need to create a psychological safe environment where they feel like they can either use the Vanderbilt model to call these things out at an appropriate time, or they know who to speak to. Because once you've formed that strategy, and once you've enlisted people to it, and once you've enabled and empowered your workforce to be part of that change, then you're going to start to generate little short-term wins. People are going to say, oh, you know what? It's much nicer working here. Or, oh, you know what? The medical students are much happier. Or, oh, you know what? The patients have been commenting that, they're not getting as many infections. And those small wins allow you to then start to build on that, to sustain that change, to capitalize on those little wins and institute these culture changes as part of your new foundation. So you're not fixing anything. You are, in fact, building something better on a newer, stronger foundation. And there's a quote by Maya Angelou, which I love in this context, which is, do the best you can until you know better. But once you know better, do better. And so a big challenge, which comes full circle in this Kotter model, right, coming back to the making the noise, is people go, well, you're telling me that I'm a racist, but no one's ever told me I'm a racist. Or you're telling me I'm a bully, or you're telling me that I'm this, but no one's ever told me this, and I've been like this for 30 years. And you go, well, okay, fine.
So, mainly we need to create an environment. And when we create this environment, people will feel this freedom of speech, and they will start sharing their feedback. And I think in the healthcare environment, it is such a critical thing. And I enjoy listening your comprehensive approach, how to, fix this. Because today in my hospital, we have more than 41 different nationalities working under one roof. And we have to make all these people as a team, and we expect them to collaborate together and provide the best service to our patients. And if we do not create such an environment, each one of those people, they're coming from a different school. So one of them, they feel free to talk, and the other one will not be able to say anything. And we will see gaps between the performances of these people. Then we will continue to lose. And I think this is a silent lose on the other hand, because many leadership, they don't also, consider this as a real problem. And also another point, what I enjoy listening from you, you start from joke till a simple joke till the sexual harassment. Many of the hospitals, when I sit together with the leadership teams, they always consider the big problems as a problem. And then the small ones, they say, you know what, this is something you can tolerate, you can close the eyes. And that's not the case, because as what you have just described, even the small wrong joke, which everyone tolerates and accepts, then later on it will create bigger problems for us. So at this point, I just want to take the discussion to the leadership part. How can leader create this environment? How can leader empower the people? Because you're in UK, you're also working in Australia, you go and visit hospitals in Canada. I think they all have the same issue. They have nurses from Philippines, nurses from India, nurses from Eastern Europe, nurses from UK. So we need to bring all this team in one pot, and we want all of them to act in the same way. So if I'm a leader of a hospital in Toronto, and I have in my hospital 40 different nationalities, how can I create this just culture environment in my operations?
Yeah, and it's a real challenge, and again, part of it is getting the basics right. So first and foremost, from my point of view, I guess it's about focusing on people. For me, there's that quote again. Leaders lead people, and managers manage things. Leadership is about people and developing those people. They need to feel. A lot of people talk about equity, diversity, and inclusion, but there's a letter missing from that. The step after inclusion is belonging, and so your job as a leader, I believe, is to focus on your people and to make them feel like they belong. You have to have a real emphasis on inspiring and empowering people to reach their full potential. And it doesn't matter what country you're from, it doesn't matter what culture you're from, or what medical school or nursing school you went to. People want to feel like they're doing well, like they can grow, like they can learn, and like they can be better next week than they were this week. I think there's something to be said, if you're going to be a leader in this healthcare environment, about sometimes being task orientated. You could be task orientated, but equally you need to think more about transactional leadership, where rather than being like, Nurse Simon, can you do male catheters? You can think more about task completion and adherence to established procedures. So again, people feel safe. It's not about, can you do this? What can you do? It's about how well did you do it? And again, that is how you empower people, regardless of what culture they're from, to feel, again, inspired, like they can grow and be part of a change. I think psychological safety cannot be ignored. One of the most significant challenges is about creating psychological safety. It is about, if you don't have psychological safety, the potential for actual learning and growth and change is cut off at the kneecaps. You have to kind of really foster open communication, and it's something we were talking about, the joke all the way up to what you want is a sense of growth, and an environment where it is okay to make mistakes, where it is okay to fail, it is okay to apologize if you do so authentically and appropriately, but where there is also accountability. And if you can shift from that task management approach to people development, if you can foster psychological safety, and if you can really embrace transformational leadership, you will start to realize that your workforce, your colleagues, they want to grow, they want to learn. And so then what you will see is that your culture will move away from a blame culture, which is what most hospitals have. Whose fault is this? Whose problem is this? Who did this? Who made this mistake? Towards a just culture, which is where it is not only okay to make mistakes, but it's sort of expected. It is expected that you will make mistakes and grow and learn from them. And it takes time because it's uncomfortable. It's uncomfortable making it normal to go, I'm really sorry that was on me. I'm going to do better next time. And I need you to hold me to account and make sure I do better next time.
In one mentorship meeting, my mentor was telling me that just speak out in one town hall meeting. And he told me that just share one of the things what you have made wrong as the leader of the hospital, as the CEO of the hospital, and just tell them who has told you this was wrong and what you have done to encourage others also to share the same thing. So I think we need to also create a role model concept, and then we need to encourage the other people, because it's from top to bottom. I mean, today, when we talk about the leadership, people think that, oh, she is talking only about the CEO of the hospital. That's not the case. I mean, we have very small groups where we have one leader and then two people working together in one department in the hospital. Even in this department, we want to hear the same just culture concept over there. And we want people to speak up, and we want people to share all their feelings openly. For that reason, we created a concept actually called OVR system. Some of the hospitals, they call it incident reporting, which is something like whistleblower as well. So we want them freely, share the things. But when I was in one conference in Dubai, one gentleman here approached to me. He said that, look, all the points what has been raised to the OVR was actually fueling the blame culture, unfortunately. So then people stopped even raising any kind of ticket over there. So I think it is all about the leadership. We should never blame any person who ever, raises any issue about the department, about the other, problems. Then we can create the just culture in this environment. I also want to touch to the medical education. You were handling the medical education vice president, title over there. And we need to also, educate the students when they were still in the educational part of their career. So how can we educate these young healthcare professionals? And what do you recommend to the new healthcare professionals when they are getting into the real job?
You know what? I think you're absolutely right. And part of it is recognizing that the stuff we're going to try and teach those coming up through training from an undergrad and a postgrad thing is that the culture we're talking about people talk about cancel culture. Look, culture is a source of strength. It is how organizations and systems have survived and overcome problems in the past. It provides meaning and predictability and security for many. And so part of the education has to be explaining to those who want to change things that fundamentally you're going to be experiencing a grief reaction at an individual and a systematic and a cultural level, right? People are going to go through anger and denial and negotiation and all those sorts of things, because what you're asking them to do is to change, to modify their source of strength. You're asking them to modify the at least espoused values and assumptions that have kept them safe for years, decades, and centuries. And so part of it is preparing people for that. The next stage is, rather than a grief reaction, is nearly a form of anxiety. So for mature cultures like healthcare to change, as I said, your senior leaders have to be convinced that a dimension of that culture needs to change, right? So productivity, burnout, whatever it is that, patient outcomes, whatever it is. And when you say that, you will find that they get a kind of survival anxiety, which is to say, are we gonna fall apart? And that survival anxiety will induce in them a desire, a need to change instantly. And then you get learning anxiety. So a big part of it is educating not just your learners, but actually educating everyone, and actually educating your capital L leaders that their anxiety around a change being a threat to their system will lead to very predictable responses like fear and denial, ignoring evidence, scapegoating, and the manifestations of learning anxiety are things like defending tradition. This is how we've always done it. Anecdotes, wow, this worked for me. Blame. Oh, you chose this profession. You knew what you were getting into. We don't have the money. We don't have the resources. It takes too much time. yada, yada, yada. And actually, you can shift the balance. You can change that using education. You can say, look, let's acknowledge that our culture is a source of strength. I'm not trying to change everything. I'm not trying to burn everything down. I want to change parts of this culture that need changing. So you have to present them with that compelling vision. And again, this is an education piece, because education has to be how you overcome resistance. You have to help people see the need for change and the rationale for change. And then you need to inform them through talks and fundamentally marketing campaigns that the change is achievable. And education and participation have to be your primary strategy for change. You say, look, there is a misunderstanding. We don't have all the information. We don't want to force anything, but we absolutely need to help you recognize that there's a problem. We need to help you recognize that your response to this problem is normal and human and not to be laughed at or scoffed at. And then how can we facilitate decreasing the fear and anxiety and grief that surrounds the way we're going to have to change it? So you create that compelling vision and you demonstrate that change is possible, and you deliver pilot studies and you show that it can be done. And it all comes down to education. I think what's interesting is when I talk about it, everyone assumes that I'm talking about educating 18 to 25-year-olds in medical school or in their intern years. And actually, I'm talking about educating everyone from the lowest of the low to the CEO. So it's interesting you talk about, it makes me sound like a gastroenterologist, because it's not just top down, it has to be bottom up as well. And actually, you have to educate everyone. You have to bring everyone along on the same journey, because if you only educate the more junior people, they will just hit these brick walls of resistance from senior, more powerful people, often the ones doing the bullying and the harassing and so on. But it is only through education that you can get people to see that there is a need for change and how it can be delivered.
Dr. Simon, hearing these points from an orthopedic surgeon is really amazing. You have tough jobs in the OR rooms, and we know that it is one of the toughest area, and we know many things are happening over there. And hearing such a thing from a person actually who has seen this as a problem and then providing a comprehensive strategy to fix this is really, great. And I'm grateful for your time. So thanks for your time and sharing all these details with us. I just want to ask your final thoughts before we close this episode.
So for me, I guess my final thoughts has to be the Maya Angelou quote, which is do the best you can until you know better. But once you know better, do better. I think for so long we've just wanted heads to roll and people to blame, but actually improving our workplace culture will save lives and protect the health, not just of our patients, but of our colleagues in our profession as well. And if we can do that, we can fundamentally save lives and improve healthcare globally just by making small changes that don't cost a lot.
In almost every episode, whenever we discuss the different subject, we're almost ending with the same point. Humbleness and humility is the most important thing, where we need to approach to our people in the best way, so then they will give their best to the operations and to our patients. Here in this episode also, we have seen the same thing. We need to create a great environment and a free environment where people can share their feelings freely, and which will, at the end of the day, support the performance, as you have heard from Dr. Simon, and will definitely create the right environment for people to flourish. So, Dr. Simon, thanks for your time. You have actually dissected a very important subject in the best way for us. And today I have learned a lot of things from you. Thank you so much again for joining us today.
Thank you so much for having me.
Thank you. Dear listeners, please stay tuned. We will have many other leaders sharing different subjects, and we will continue to learn from them. Thank you.